So a little bit about me. My name is Kaylee. I'm a clinical dietitian. I'm a certified health educator and nutrition support clinician. I have experience in public health education, patient advocacy, and providing medical nutrition therapy in a variety of settings: the hospital, outpatient clinics, home infusion, out in the community. But prior to all this, my journey in clinical nutrition support began as a consumer myself, relying upon nutrition support, which ultimately inspired my career in clinical nutrition. Now I have the utmost privilege of serving as the manager of education for the Oley Foundation, where I help develop, coordinate, and oversee all the educational programs and initiatives that the foundation offers. So definitely keeps me busy. I'm so excited to be here with you all this afternoon, and for the collective impact we can have on the home nutrition support community. And I will be joined this webinar by my colleague Vince, who will be representing the consumer patient perspective. Do you want to introduce yourself, Vince?
Yeah, absolutely. Thank you for that, Kaylee. And I'm so excited to be here today. This is such a good topic. I know that we've talked about this several times, and I'm excited to be a top part of this one. Like Kaylee said, I am a consumer. I was born with chronic intestinal obstruction. At a very young age, I started to have lots of issues with motility and bowels. I got my first G tube when I was 4, got my first PICC line when I was 6. I've been advocating for my own health pretty much my whole life. When I was 6, 8 years old, I remember telling a nurse that she was giving me the wrong pill and that she needed to go out and ask her charge nurse and make sure, because I was advocating that I was supposed to be taking that pill. I've done some advocacy over the years as well, and currently I am on TPN. I have a femoral central line, so that's a little difficult to deal with than the average central line. So I'm excited to give my tips and ideas of you with the bathing and swimming and things like that with femoral central lines. But now I am thankful to be part of the Oley Foundation as a community engagement coordinator, engaging with the community and making sure that they are receiving the resources and the education that we can provide to them. So yeah, thank you, Kaylee.
So you'll be hearing more from Vince towards the end of the presentation. It'd be helpful if I unmuted myself. So thank you, Vince. You'll be hearing more from him towards the end of the presentation. We have no disclosures or conflicts of interest. And again, you'll see that medical disclaimer. These are learning objectives. To get things started, I wanted to share this slide. Outlined here are the different routes of nutrition support, or those that are commonly seen in nutrition support, associated with enteral nutrition on your left and parenteral nutrition on your right. So you'll see the routes, the entry points associated with tube feeding or enteral nutrition typically enter the body through the nose or through the abdomen, depending on where nutrition needs to be delivered to: the stomach, the gastro or that G tube, or the small intestine, the jejunum, or you'll see that J tube. Tube feeding involves delivering formula through the gut, so therefore tubes are used. However, on the flip side, with parenteral nutrition, this form of nutrition is bypassing the gut. So we're delivering nutrition via the bloodstream through a specialized type of IV access that we at Oley refer to as a central venous access device. Kind of a mouthful, so you'll commonly hear me refer to it as CVAD. I'm sounding out that acronym, CVAD. Typically, consumers of parenteral nutrition have this access through a part of the chest or the neck. However, this isn't always possible or feasible. Like Vince said, he has femoral venous access, which is located closer to like the leg or groin area. Some consumers have PICC lines, which is located in the arm. Most consumers of parenteral nutrition have some type of tunneled CVAD device in the chest or kind of closer to the neck. Although some of our consumers might have various medical needs and might have an implanted device such as a port, which is typically used for more intermittent therapies. But like I mentioned, a lot of our consumers of nutrition support have multiple medical needs, so they might have a couple different devices. You can imagine, however, that those with a CVAD, so access to the bloodstream, are at higher risk for infection just due to the nature of that type of medical device. It giving access to the bloodstream near where the heart is. So if something were to harm or contaminate that line, it would have access to the bloodstream readily. So when we're thinking about water-related activities, those with a central venous access device are going to be higher risk for infection. And so the recommendations that we'll be going through are going to be a bit more conservative for parenteral nutrition compared to those with feeding tubes. But let's go ahead and get started. We're going to break things down. We're going to start off with bathing and best practices with bathing. So in general, it's not recommended to soak the area where the feeding tube is for the first 4 to 6 weeks after abdominal feeding tube placement. So that's just to allow the stoma where the feeding tube is entering the abdomen to completely heal. We have a newly created wound or opening, so we want to let that fully heal and mature. During this time, though, it's generally okay to shower. It's okay for it to get wet. You don't necessarily have to cover it unless you've been instructed to otherwise. And then after that 4 to 6 weeks, typically you have a follow-up with the medical provider. It might not be the medical provider that placed it, like if you got it placed in the hospital, for example, but some type of medical follow-up. Just make sure that you get clearance before soaking the area or trying to bathe versus shower with it. When you are bathing or showering with feeding tube, it's a good idea to cleanse the area only using mild soap and water. There's no need to use other harsher cleaning products like rubbing alcohol or hydrogen peroxide or more involved with soaps that can actually cause some skin irritation and breakdown. So all you need is mild soap, water, and then after you're finished, you can just pat dry using a clean piece of cloth, gauze. If there is discharge buildup underneath like the bolster of the tube, you'll see some of the pictures on this slide here detailing that. You can also use a small piece of gauze or even a Q-tip just to gently clean around like the bolster of the tube. If you have a nasal feeding tube, you can typically shower per usual. Make sure that the tapes that you're using that secure your feeding tube are waterproof, because if not, it won't be very helpful or hold up well in the shower. And then you can clean actually the area around where the tube is in the nose, like your nostril, using a Q-tip as well. During this bathing cleansing process, it's also a good idea to assess the area around your feeding tube, including when it's placed in the nose, for any redness, swelling, irritation, new or like an increased volume of drainage. Those are all red flags to follow up with your healthcare team about. And it's helpful when you do this on a daily basis. That way you have a baseline to work off of. Moving on to best practices of bathing, showering for when you have a CVAD, a central venous access device. So it's important to keep in mind that here in the United States, the standard of practice for CVADs is typically to have what's called a dressing. So you'll see like in that bottom picture here on this slide, that kind of like white, looks kind of like a butterfly shaped over where the line is inserted into the arm. The dressings purpose there is to protect the insertion site from accidental dislodgement, like getting tugged, pulled. It also protects the insertion site from potential contamination from things like moisture or bacteria. So it's important at baseline, especially like before you're about to bathe, but just throughout the day, making sure that that dressing stays secure, intact, and dry. It's also important to make sure throughout the day, and then especially when we're about to take a shower and we're getting ready, making sure that the injection cap, so the little blue caps you'll see in that bottom picture where tubing or medications would attach to the line itself, but that's staying dry as well. That's another potential hub or entry point for bacteria or infections. So we want to make sure when we are prepping to take a shower that all these areas are staying dry. So it's recommended before showering with the sea bag that you use some type of waterproof cover, like a clear waterproof cover, to protect the insertion site and dressing for activities like showering and washing. Keep in mind that these are typically only designed for short-term use, such as showering. It might vary based off of who your home care supplier is in terms of the brand or the type. Common brands are like Hydroseal, AquaGuard, Tegaderm, but of course, make sure that you review and take note of what adhesives work well for you, what don't, what may cause or contribute to skin irritation. If you have any sensitivities, like latex in particular, make sure that you are collaborating with your home care supplier and your medical team if you need particular orders, to make sure that you're getting what you need to protect your line during bathing and showering. Vince will go over what's worked well for him in practice and how some tips and tricks on how to best secure it. I have heard from consumers that really applying pressure to the outer areas to make sure that you're getting those edges securely onto the skin and you're removing any gaps. So, and then sometimes using like reinforcement via tape can also help. I know when I had a central line years ago, it also helped being strategic during showering in terms of how I was positioning. We don't want to submerge our sea bag underwater, or we want to avoid having it being sprayed directly with into a stream of water. We can avoid that, test of exposure. That's ideal. So I had, privilege of having access to a shower head that was removable. It was handheld. So that really helped positioning during the shower. I could just simply remove the handle and spray where I wanted to while avoiding my central line. What also helped too is just, being intentional about how I was positioning my body if I was using a different shower. So if I was washing my hair, tilting my head back versus just standing directly underneath the stream. Some consumers, especially if you have a medical line that's higher up, prefer to bathe and just keep it out of the water. But if you have questions about how to best approach bathing, showering, definitely collaborate with your healthcare team to see if they have any recommendations too. And then once you get out of the shower, recommendations are to pat dry whatever covering you've used over your central line, just to remove any water droplets that could potentially contaminate the area if you go to remove it and it trickles down. So patting it dry, and then after you remove that plastic covering, inspecting your line to make sure that the dressing is still dry. Also make inspecting the skin and area around your line a daily part of your care routine, kind of like how we reviewed with feeding tubes. That way you have a baseline to go off of day to day. If you notice any issues with the dressing, like it's starting to lift, it's wet, that would warrant the need to then change that dressing. All right, so let's dive a little deeper into, and pun was totally intended there. I'm not even going to play it cool. Some potential risk or considerations with other categories of water. So this graph here off to the right is actually a time series study conducted by the CDC. You'll see starting in the 70s all the way to 2019. And you'll see here that the CDC, when they were breaking down the incidence of waterborne illness outbreaks, the majority were associated with recreational waters, including lakes, oceans, public swimming pools, water parks. They did note in this report that proper maintenance of recreational water may play an important role in minimizing outbreaks, as many of the outbreaks occurred in pools that were in violation of maintenance standards. Not all waters are created equally too. So when we're talking recreational waters, there are certain bodies of water like lakes and ponds that are just more stagnant in nature. They're more likely to be contaminated with animal matter and really give bacteria the opportunity to thrive. Here in Florida, I mean, it is just so hot and those waters are so stagnant. I can only imagine they're like little petri dishes. Hot tubs too, for the same reason, are notorious for bacterial growth. You'll see even in some other recreational waters, like public swimming pools, if they're not properly maintained and they're being frequented by the public every day, bacteria can begin to accumulate and actually kind of clump together in bundles to form what's called a biofilm. You'll see at the bottom of the left picture here, which can then attach to different surfaces like pool filters, pool walls. So these findings suggest that certain water environments may not be ideal or optimal for individuals that are at an increased risk for infection, such as those with medical devices, especially those with a central venous access device. More controlled environments might be more ideal, like private swimming pools, as long as they're well maintained, theoretically. Could be a better alternative. But the caveat is that, despite a growing number of individuals with medical devices like CVADs or with complex care needs, the risk of infection after swimming, it hasn't been well studied. There really still needs to be research on this topic, and it's a difficult topic to research because of all the different barriers. I mean, from consumer to consumer, but also in terms of different types of water exposures. So there's currently no strong evidence to conclude that swimming has created an increased risk or incidence in Lyme-related infections, but on the flip side, there's also not a lot of research or evidence to support that it's a generally safe practice for consumers with medical devices such as a CVAD to go swimming. So when we go through recommendations throughout the rest of the presentation as it pertains to swimming, really needs to be in collaboration with your healthcare team. These are just kind of general recommendations we'll be discussing. And this is applicable to everybody, whether or not you have a medical device or complex care, medical needs, is thinking about the water quality of where we're going swimming or where we're visiting. So it's extremely important, especially if you're at an increased risk of infection, to check the contamination levels of the water that you do plan on swimming in on the day of, if possible. Like, for example, runoff from recent rains can even contribute to contamination levels. So it can fluctuate from day to day, especially if we're thinking about bodies of water that are outside. The sites listed on this slide are just a wealth of information. So they're free and open to the public. And they have links to state-specific healthy swimming resources, since we have people calling in from all over the place, which is awesome. There's also information on beach monitoring of water quality programs, facts on recreational water illnesses, pool code information, and then contacts to local health authorities or local departments of health. For the water quality, when it comes to public pools or hotel pools, check in with the people who are responsible for maintaining them. Ideally, daily testing should be considered the minimum standard. Many facilities do test multiple times per day and then will close the pool if levels exceed a certain threshold. In some states, including Florida, public swimming pool testing results are posted online. But, keep in mind too that even if pools are well maintained and they're being tested regularly, sometimes, people that really shouldn't be swimming in swimming pools that, for example, maybe were recently or are currently sick, or maybe infants or toddlers with some suspicious looking swim diapers, they can also contribute to potential waterborne illnesses. So it's always a good idea to not just checking in on the water quality, but also checking in on maybe their policies, how they're regulated, how the pools are being visually monitored. And even if maybe there's a time or day of the week that maybe the pool is less crowded or has, things have just been tested, to kind of be strategic about the best time to go. Proper maintenance and testing are also important when we're thinking about private pools, including your own. So make sure you're well trained or versed on how to maintain and test your own pool water. And then also make sure that your guests are aware of the importance of making sure that we're not swimming if we have certain symptoms, or if we had a recent illness or sick exposure, and we're being aware of some of our younger swimmers that may be wearing swim diapers, since those haven't been tested for efficacy when it comes to like swimming and truly holding up, and its relation to potentially waterborne illnesses. All right, so let's chat about swimming with a feeding tube. I love the diversity and pictures over here on the slide in terms of ages and types of feeding tubes. When I was pulling images for this slide, I was surprised to actually see this turtle pop up in my search. Looks like this turtle has either a nasal or an orogastric feeding tube, and I love how they utilized its shell surface to secure the tubing on the back of its shell. So very similar to the recommendations when we were talking about showering or bathing with a feeding tube. Overall, consumers with feeding tubes, as long as the stoma site, so where the site where the feeding tube was placed in the abdomen, as long as that's healed and healthy, and we're being mindful of the waters that we are swimming in, consumers can generally go swimming with a feeding tube. It's not a contraindication unless something else is going on. I do recommend, especially with new feeding tubes, after like that 4 to 6 week period after placement, verifying with your healthcare provider certainly that you are medically cleared to go swimming. There might be some other things going on that would make swimming not an ideal activity for you, depending on why you got the feeding tube, and again, maybe some other health components. But if you have received a medical clearance, tube is looking good, medically you're okay to go swimming, it's some recommendations to help make swimming successful with the feeding tube is making sure that the cap and the clamp of the feeding tube is closed to prevent leakage, accidental dislodgement, things getting up the feeding tube. You also want to make sure that the feeding tube itself is secure. So if you have a low profile, like a button style tube, you'll see the two gentlemen here on the slide, bottom left corner and then middle right. The button style tube, there's really not too much to do in terms of securing that tubing. We just want to make sure that extension sets or anything that plugs into the tube are left out, and the cap of that feeding tube is closed and securely closed so it won't accidentally open. Now with standard dangler style tubes, so actually what the top right picture includes, she's not currently in the water, so it doesn't look like that tubing. Actually, that looks like a low profile tube with an extension set. Scratch that. But that is in theory the tubing that an individual with a standard feeding tube would likely have. You want to make sure that it's secure with waterproof tape, for example, kind of what they did to that turtle. This applies to nasal feeding tubes. I love what the swimmer with the swim cap at the bottom right-hand corner did. She actually tucked her tubing into her swim cap, and then she taped the nasal feeding tube to the side of her face with some waterproof tape. What also can help with for consumers with external tubing, either a nasal feeding tube or a standard dangling style tube. If tape isn't working out well for you, some consumers choose to wear like a one piece. For our gentlemen, like a tighter swim shirt can work well, or tucking it into swim shorts. They also make waterproof belts, or even like different abdominal kind of pieces to help keep tubing secure. So all of that can be explored just to, again, make sure that things aren't accidentally getting tugged or pulled. But as always, consult with your medical provider to ensure that you're medically clear for swimming or water-related activities. All right, up next, I'm going to go over swimming with a CVAD question mark here. So I just want to start off with that medical disclaimer that because there's not a lot of research on this topic, please consult with your healthcare provider for additional information. And if swimming may be an appropriate water activity or physical activity option for you. So Oley did partner with multiple large home parenteral nutrition programs across the country some years ago and posed the question, do you allow your consumers with CVADs to go swimming? And the response was a bit mixed. Of those programs, though, that did allow their consumers to go swimming, all of the programs only allowed consumers that have had their line at least 30 days. The line site is completely healed and matured. So similar to the recommendations with the feeding tube, we want to make sure that there are no fresh or open non-healed incisions. The programs also noted that they individualize these recommendations based off of, the individual themselves, the consumer themselves. So do we have an increased infection risk outside of having a CVAD? Are we on medications that further suppress our immune system? Do we have other health issues that would make us even more of an infection risk? What about a history of line infections? What about our ability to really well cover that area and make sure that we're keeping things, as clean and dry during the process as possible with our line. Like, what are our resources? What are our physical abilities? And then the programs also noted that they provided outpatient education in terms of making sure that consumers are well aware of how to check for water quality, that they're counseled on what bodies of water are recommended for exposure. So some of the programs noted that they would only allow their consumers to swim in private swimming pools versus restricting access or recommending to restrict water activities in bodies of like lakes, ponds, certain rivers, certain beach areas. So they also talked about, like, it's not a blanket yes to water activities. They're really being mindful of the patients that they're saying yes to and the bodies of water and water quality that they are pairing those recommendations with. Of those programs that did allow swimming, for swimming, recommendations were fairly similar to standards of practice for showering. So covering the area with different kind of plastic waterproof coverings, like we had reviewed before, like the AquaGuard, the Tegaderm, the HydroSeal, before water exposure, making sure that we're keeping the dressing and the end caps as dry as possible. It is important to keep in mind, though, that these products are not FDA approved or tested for swimming use. They're only FDA approved for short-term use, like in the shower. There are special outfits or like adaptive clothing options that might also make water activity safer, in theory, for some consumers with sea bags. So, for example, you'll see in the top right corner, this individual is wearing a dry suit. They can be fairly expensive, but dry suits are typically custom designed, and they have gaskets like at the wrist, at the neck, at the ankles to keep water out, not to be confused with wetsuits, which let water in. So sometimes this is recommended for consumers that have been given that medical clearance to really ensure that things are staying dry, on top of using the coverings to also further protect dressing and end caps in the line itself. And then again, they recommended, just like with showering, patting dry the covering when you're before you're ready to remove, and then after you remove that covering, really making sure that you're inspecting the area well and performing any site care that's needed immediately after, like if the dressing has gotten wet, for example. I do want to note that during this report, a couple of centers mentioned that, some lines might be more ideal for individuals that are avid swimmers. So, for example, like ports implanted devices, or even thinking about the location of access, although a lot of the access locations are based off of, our history of access, or even our anatomy, just like the medical feasibility. But it does warrant a collaborative discussion with the healthcare team and the consumer. So what are your lifestyle goals? What's most important to you when we're thinking about the type of medical device that's being chosen for the consumer, and what your options are and how those might impact or relate to quality of life, comfort, and even like lifestyle physical activity goals. Keep in mind, though, that implanted devices like ports are generally not ideal for consumers that have daily needs, so like parenteral nutrition, for example, but might be, an option for those that have more intermittent needs like IV hydration. But again, this call out was just to encourage that collaboration between the healthcare team and the consumer in terms of how can we make your lifestyle as unchanged as possible, or, without negative impact, when possible, of course. But again, all of this is highly individualized and requires close collaboration with the healthcare team, which is the primary take-home message here. Because there is still mixed research on this topic, it's very important for patients, caregivers to have an open discussion with the healthcare team. And, for all the clinicians out there listening in, I would also encourage you all to incorporate this as a part of discussion, ideally leading up to, CVAD or feeding tube placement. But, when providing education about daily site care maintenance that we're talking about, how that relates to swimming and bathing and showering and best practices. That communication, that education is so crucial for, making sure that we're avoiding complications and hopefully avoiding or lowering infection risk for some of our consumers. So with that being said, I'm going to turn it over to one of our own consumers with both a feeding tube and a central line vents, if you want to share a little bit about the consumer's perspective.
Yeah, thank you for that, Kaylee. And some of that information you said in there would have been helpful for a few years of me ago when I had a jet ski and I decided to contract pseudomonas in my central line. So, yes, I think testing the water and the things that you brought up are very important when it comes to water activities and when we're chronically ill and have different things going on with our systems that may be different from the average person. And I know it seems like a hassle to test the water and do these things, but it's not a hassle if you don't end up in the hospital and your health remains intact and things like that. So yes, it may seem somewhat annoying to do checking the water and doing these little things to prepare, but it's going to keep you healthier in the long run. I've learned that myself. If I would have checked the water that day, I definitely would have not gone in there if I saw positive bacteria. For some back information, like I said, I do have a G tube. I have the gastric stimulant and a femoral central lines. So some of these devices do make water kinds of activities scary at first thought. Luckily, there are some devices on the market that I have found that definitely will help. Since having a G tube, there hasn't been much changed in my life with the G tube. I'm pretty lucky that I got my G tube at age 4. So it's been healed for years. And I remember after several months of it being healed, I was in the pool with my cousins and all my friends, just like every other normal kid. So I wouldn't say too much changed for my G tube. Me and my cousins would swim like almost every single day. And I really also don't remember protecting my G tube. But then again, this was like the late 90s. So technology hasn't advanced and there wasn't as many things on the market to secure feeding tubes and stuff. So I know I had used a wetsuit before. There's some places in Florida that have like spring water. And I know that from my personal experience when I was younger, I would wear a wetsuit and that would seem to keep my G tube more intact, similar to that dry suit that Kaylee had shown a few slides ago. What that would do is allow like the suit to kind of sit up against the tube and just kind of hold it securely. That seemed to really work for me. And then also being malnutrition and small, the wetsuit kind of helped keep everything a little warmer. There is so many devices on the market now that I wish I had to secure my G tube back in the day. Devices like Gus gear. So if people don't know what Gus gear is, on the next slide, don't go there yet though, Kaylee. The next slide, there is some things some products that I'll show that I wish I would have had back in the day, like Gus gear. Gus gear is basically like a kind of looks like a chest protector or like a bulletproof vest, similar. And you can go to the next slide if you want, Kaylee. That's fine. That way they can see it. So on the top right there, that Gus Gear securement device. So that is something that I wish that I would have had when I was younger. And these are the things that are now in the world that for tube feedings and for lines. And what this is like a device that you wear. And in this red patch here in the middle, that kind of flips out like a pocket. And then all your tubes and everything get secured in there. And then that flips up. So that's something that I find that's very helpful for patients. And I wish something like that I could have definitely had when I was growing up, because I remember being in the pool and jumping in and feeling your tube tug with the water. It's just not the most comfortable thing. So the Gus gear, those will definitely help. Same as that cinch, the tube securement device, that will also help as well. And that's something that I wish I would have had when I was a little bit younger, especially with younger being more active and being less self-conscious about tubes and things like that. Now, when I'm talking about femoral central line is what I have. So that's a line that's in my leg. Water activities are a little harder for me because it's right at like the base of my thigh. So there's been a couple things that I've used over the years with PICC lines and other CVAD devices that has also worked for my femoral line as well. And on the bottom left corner there of that slide, the thing that I have used for years and years and years, and it has always worked great for me, is press and seal. And I know most of you probably have this in your kitchen, but press and seal for me has been a great source to keep water and keep my line dry. So what I typically like to do is start at the very top. So if my PICC line, let's say, is here, I will start at the top and I will wrap it around, making sure that all the edges are really smoothed down. And I typically wrap 2 to 3 times. The reason I do 2 to 3 times is because sometimes water can seep in between the layers. And if it seeps in between the layers, it can seem to stay off of the dressing or off of the biopatch, needing to be dried or changed potentially after the shower. So something that I use literally every day, whether a PICC line or whether it's my femoral, the press and seal definitely seems to work for me. There are some other things as well, like on the top right there, on the top left is that IV site barrier protection called Hydro Seal. Those can work as well. I personally haven't had the best luck with them, but there is ways to make them work pretty well. The way I would suggest using something like that, or like the Tegaderm is another secure protection. Um, you would want to make sure your skin is very dry. So I think where people miss is they've already been in water, or their skin is already moist, or they're already in a damp situation, and they try to stick one of these devices to their skin. And that is going to fail every time, I have learned. My procedure, if I'm going to use something like a Hydro Seal or a Tegaderm to protect my line more, I'm going to make sure that site is extremely dry. I'm going to extremely dry that surface. I'm going to take some type of baby wipe or some type of protection wipe to make sure the skin is clean. I think that's the other thing we don't think about is the oils that are on our skin can really make sure these devices don't stick. So I like to clean the area around my line, making sure that all the skin is nice and clean. There's no gunk on there. There's no sweat. And then I will try to stick one of these on the surface that I'm working with. There's some other things that you can use as well. They make products like called Skin Prep, which is basically like a barrier film. You can put that on first and it'll help adhere the bandage. I will say with that, you need to ask your provider if that is something that you can try though, because that solution has stuff in it that you may be allergic to, or your dressing that you're currently using may come in contact with it and may not be allowed. So I would say if you want to think about using a solution to make it stick a little bit more, then they do make solutions like that. But I would recommend talking with your care team. I know I use Skin Prep. It's what comes in like my dressing change kits. It works really well for me. I really have no issues with that. So I have found that that really helps a lot. Um, when it comes to showering, I think I'm very much the same as what Kaylee was saying. It's about placement and how you face in the shower. I find that really seems to make a difference. So for me, my line is on my right front of my leg. So when I'm in the shower, I'm typically have the head of the shower hitting my back. And what I'm trying to do is just have water like slightly come down my chest. And actually, I think I'm going to get one of those wands because I think that's a good idea, Kaylee. I think I'm going to try one of those because I think that would be even a better idea for what I use now. But typically, what I'm doing is doing that. I'm facing away from the shower. When it comes to my G tube, I would do the same thing Kaylee suggested as well as like clean around the G tube while I'm in the shower very slightly, maybe with a Q-tip, maybe with a washcloth. The thing I like to avoid is direct water hitting my G tube. I'm very lucky that I don't have G tube pain or really any issues too much with my stoma. But if I am standing facing the shower and it hits me directly in my G tube, it will cause some pain. So I try to do that, try to stay away and really manage how I'm facing. And then I just try to let the water kind of drip down me so that way I'm not submerging or having a full like flood of water coming over my line. Um, let's see, what else kind of tips do I have for you guys? Oh, so talking about the Tegaderm, there's been methods that I've used in the past for showering and for going out, like when I went on my jet ski a few years ago and got pseudomundus, which I recommend a jet ski, but not pseudomundus. What you can do is I've done is taken a piece of gauze and putting it on top of my current dressing. And then I've taken that Tegaderm and putting it on top of that. And what that has done is made basically another little seal on top of the dressing. What I like to use that for is in case that gauze gets wet, then the gauze hopefully stays wet and it doesn't transfer into the next dressing and into the line site. The reason I also like that is because then I can judge if I kind of need to change the dressing or not. If I notice that if I take the gauze and the Tegaderm off after I've been around water and I notice that the gauze was severely saturated in wetness, I would probably change my dressing or think about what the next steps would be. If the gauze is completely dry, then we know that worked and I probably wasn't able to or wasn't around too much water or didn't get soaked. But there's some ways that I've done that before. With the Tegaderm and some gauze that definitely seems to help. I personally have never really had too good of luck with the Hydroseal, but I have had some luck with other devices. Now, if there's times where anything fails, so let's say I'm in the shower and my press and seal came off or my securement device has fallen off, the first thing I'm going to do is shut the water off. I'm going to shut the water off and I'm going to grab my towel and I'm just going to try and dry the surface and then evaluate the situation from there. If the dressing is absolutely soaked, I will change the dressing. If the dressing seems to be dry, I will wait and give it a few minutes and see how it works. But really, it's kind of basically about how long or how much experience have I had? What have I seen before? What have I done before? And I think that's a lot of what bathing and swimming is yes, we can pretty much all do it in some extent with modifying and changing the way we do certain things, but we still all should be able to be around water and take showers and stuff like that. So I think that and be able to have a like fun filled day by the pool with your friends. That's something that everybody should be able to enjoy. And just because you have a central line or a tube doesn't mean you shouldn't be able to participate in that. A few things that I like to bring with me when I'm around water or like when I plan to be around water is one is a portable fan. I like to bring a portable fan with me if I'm going to go out in the heat or if I'm going to be by the water or let's say the beach. They're pretty inexpensive off Amazon or even like from Home Depot. What that does is just allows the breeze to stay over me. I try to face it towards my line area so that way there's a constant breeze. Florida is very hot and humid and not really breezy where I'm at, so a fan is necessary for my water adventures for sure. Another thing I like to bring is ice cold water. So cold, it feels like you're in Antarctica. What that does to me is I do that for two reasons. I'll drink some of the water to keep myself cool, and then I'll also usually take one of the water bottles and kind of keep it on the back of my neck and do that in rotation. And that seems to really keep me cool, which again will keep sweating down and potentially not sweating off your dressing. So these are all just tips that I do so that way I really make sure that my dressing stays intact if I'm going to be around water activities. The other thing I will always do is bring two dressing change supplies. So if I need to change my dressing, I will bring everything to do it twice. So that way I have plenty of supplies. The reason I do that is because one, if you only bring the one set of supplies, that's when something's going to happen and you're going to drop something on the floor and you're going to have no supplies. Two, it's very hot where I'm from. It's very humid. So I like to have two sets of dressing change kits just in case I need to change my dressing again. Because in Florida, it's like 98% humidity today at 9 a.m. So I need that when we're talking about Florida. Some other things I like to about staying dry is the HydroSeal protection, the Press and Seal, like I mentioned, and then the Tegaderm. For CVAD patients and caregivers, managing water or bathing with a feeding tube and CVAD devices, I think is the first step to ask a doctor or the team members when managing a care what they suggest. If they have any tips or tricks, or some physicians are more familiar with this topic, they may have procedures that they like to do with their patients. So I know I have always been in contact with my doctors about what I want to do. When I got a jet ski, they were even aware that I got a jet ski and I would be in the water and doing these things. And they gave me some advice. Do this, protect the line this way. If this happens, this is what we do. I suggest talking with your care team. If you have little ones and your little one wants to go in the pool, that's completely fine. Figure out a way that that can work with your provider and then also work with you as well. Now, if your provider does not have the knowledge on bathing or managing water activities, Oley does have some great resources like this webinar and some other ones on our website. And then there's also some other groups out there like Facebook groups on traveling and adventuring that really kind of bring home more what you can do with a central line or a feeding tube. But I will still say, please consult your care team before you try to just go swimming or anything like that because you've seen somebody else on Facebook was able to do it. But I will say, really making sure you connect with your care team and plan vacations, plan going to a cruise, plan all that out and see what it works, see how it looks, and then there's devices out there that can make that pretty successful. I found over the years that there was only a few times that water activities I wasn't able to do, and that was usually because I didn't bring something to protect my device or something like that. There's also something I want to mention too. If you're going to hook up or be disconnected while you're in the water, there's also things like this little device here. This is what's called, let's see, what is this called? A valve guard. And what this does is this kind of goes over your lines and protects them. So it like goes over the end of your lines, similar to this. And it has like a seal. So that's good if you want to be like hooked up or if you'd like to protect the end of your CVAD device while you're in the water as well. So if anyone has any additional questions, I'd love to answer them now. Or if anyone have any questions for Kaylee as well, we're going to open it up to questions. And we are going to use the Q&A feature. So if you do have questions, please type in the Q&A. And we'll get a few questions. I know we have only a couple minutes left. I'm sure we can answer some questions. And then if you do have more questions, you can always email info@oley.org and ask questions as many as you want. And either I or Kaylee or one of the team members will get back with you with some more education and some more resources on Splish Splash.
I know we ran over a little bit in time, so if anybody has any questions and they don't have time to stick around for the response, you can email us at info@oley.org and we can reply to you there as well. I don't see any coming in now, but again, I know that we ran over a little bit on time. So, I think we just got one question. Vince, what was the name of the last barrier that you mentioned?
So the last barrier I mentioned is called valve guard, and I'm gonna put, let's see, I should be able to put it in the Q&A. So Melissa, if you can I don't know if anybody can see that, but it's called valve guard. The company is called Ivy Clear, and they make it. And I just literally typed in Ivy Clear on Google, and it came up, and they make several different sizes of this. It's VALGUARD, and I get it through Option Care. I also did get them through Quorum as well when I was with them for a DME, but you are welcome to ask for them. If you would also like to email info@Oley, we can get you the product number. That seems a little bit easier to help when DMEs are trying to find stuff.
And
And
it
then
looks
what?
like we got one more question about information surrounding tunnel lines, but without dressing. So that's a good call out that not all central lines, particularly those that are tunneled or implanted, are going to have those dressings. So, but the recommendations do not change regarding protecting that area with a waterproof covering, making sure we're, blotting and keeping that area as clean and dry as possible.
Yeah. And the next question is, yes, is that hydro seal that I had mentioned is pretty big. It's a big section, and it does take up, I mean, I'm not a big guy, but it would take up most of my chest. I will recommend, though, making sure that you really get all the edges of that hydro seal down. That hydro seal does not have the best sticky backing because it's not meant to be there forever. So just make sure you're really getting those edges down. And then what I like to do is like move around and kind of make sure there's no gaps. And then if there is, I push it down. But yeah, the hydro seal should be able to do a 5x5.
And that was good call out as well. The original question was asking about the sizing of products and if it's large enough to cover an area of the chest. That is always a good question or detail to specify with your home supplier in terms of the sizing of the product, because a lot of these products do come in different sizes to accommodate different types of catheters and lines and tubes. So when in doubt, ask. So you can make sure you're getting something that's appropriately sized to cover the area in need. And then last question is, in the hospital, they recommend daily CHD baths. Is this something that should be carried on at home? No, not necessarily, unless there's a specific reason as to why that was prescribed for you or recommended for you. Like if you have like some resistant localized like skin infection going on, that needs to be disinfected or treated a certain way. But in the hospital, they like to keep things as sterile as possible. So that's typically what they provide you, like that hospital soap, or site care, like the bed baths. But for day to day, typically that's not the recommendation. No. Vince, have you experienced otherwise?
No. The only time I'll ever use CHG baths is typically in the hospital. And then sometimes, depending on the physician that puts in my line, they might suggest it for a few days afterwards once I go home, just to keep that area around the dressing nice and secure while we're in that healing process, but not a daily thing at all for CHG. I know I'm actually allergic to CHG, so I have to use the opposite chemical one that they offer in the hospital, but that's not something that I typically do. No.
And that's a good detail too, to include events that, they might have different recommendations too while the site is healing, or maybe you still have stitches or, something acute has popped up. But I think we are all out of time. So, like I said previously, if you have any other questions, feel free to send us an email at info@oley.org. Thank you so much for joining us. And we look forward to hearing from you, what other questions you have, and offering more content like this moving forward.
Yeah, absolutely. And if you guys have any more topics that you'd like us to talk about on different things, please also email info@Oley and give us some topics to do webinars on. We're always looking for great topics that the community wants to see. So please email us. Have a great day, everybody.